Name the attachments of body of typical thoracic vertebrae. The upper and lower borders of the body give attachment in front and behind respectively to the anterior and posterior longitudinal ligaments. Describe the transverse process of thoracic vertebra. They project backwards and laterally from the junction of pedicles and laminae between the superior and inferior articular processes. A facet is observed on its interior surface near the tip for articulation with the tubercle of numerically corresponding rib. Tip provides attachment to lateral costotransverse ligament. Its anterior surface medial to facet receives attachment of inferior costotransverse ligament. Superior costotransverse ligament is attached to the lower border of the transverse process. The intertransverse muscles are attached to superior and inferior borders of the transverse processes, and at last, posterior surfaces of transverse processes near their lateral ends provide attachments to levator's costarum.
Describe the ossification of thoracic vertebra. The ossification of thoracic vertebra and typical vertebra is similar. It ossifies in cartilage from 3 primary and 5 secondary centers. The 3 primary centers, one for the centrum and one for each half of the neural arch, appear during 8th to 9th week of fetal life. At birth, the vertebra consists of 3 parts: the centrum and 2 halves of the neural arch. The 2 halves of the neural arch fuse posteriorly during the first year of life. The neural arch is joined with the centrum by neurocentral synchondrosis. Bony fusion occurs here during the 3rd to 6th years of life. 5 secondary centers, one for the upper surface and one for the lower surface of the body. One for each transverse process and one for the spine, appear at about the 15th year and fuse with the rest of the vertebra at about the 25th year.
Name any 2 applied aspects related to thoracic vertebrae. Failure of fusion of the 2 halves of the neural arch results in spina bifida. Sometimes the body ossifies from 2 primary centers, and if one center fails to develop, one half, right or left, of the body is missing. This results in a hemivertebra and lateral bend in the vertebral column or scoliosis. In young adults, the discs are very strong. However, after the 2nd decade of life, degenerative changes set in, resulting in weakness of the annulus fibrosus.